Hi everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching our videos today. All my videos in this particular compilation video today, so I think there are 3 altogether, I think, can't quite remember. But I know the last one's a really interesting one, so make sure you stay tuned for that one. If you enjoy perforated eardrums, I've got a doozy for you later on. So what we've got here is a very, very deep piece of wax. This is classic cotton bud use. So what we've got is this very thin layer that's stuck to the outer portion of the ear canal, and then you've got this very, very deep central layer then, which is covering the eardrum. A lot of dry skin underneath it, just peeling around all around the outside edge. Just start peeling and peeling and peeling. There you go. Trying to detach this outer layer before we can start working on that central plug. There we go. It's starting to lift. I think this bottom left corner here is going to give us some trouble by the looks of it, because that is super sticky in that corner. That has a lot of dead skin down in there as well. Oil's gone in. I've flooded this with oil. You can really see a lot's gone in here, and that's going to really help to work underneath. As soon as we start to lift this edge, basically I need to detach this bottom left corner. That is really firmly stuck against the canal wall there. But with the oil going in, you can see we're starting to get the lift. There we go. Now we're starting to see a little bit of differentiation between the wax and the canal. So we're starting to see where the two meet. Now I know I'm working on this right hand side, but I really think that bottom left is going to stop any plug from coming out. My goodness, look at that peeling away. Look at all that dead skin in there. How far back does it, how impacted is this wax? Yeah, it's pretty impacted in there. So basically, whenever you use a cotton bud or a Q-tip, if you're in the US, same thing. Basically, when you push this in, what it's doing is it's actually compressing the wax together. Now, I know people say, oh yeah, I get some out. You do, you're right. There's going to be some on the end, of course there is, but it's mostly kind of your natural oils you're stripping away, which are the wax color. But what you're doing for the most of it is you're putting a blunt instrument in there, which, you know, you shouldn't really put anything in your ears, but what you're doing is compressing the wax together. So what it's done is it's shoved it on, squished it together, which makes it a lot harder to remove, and it's not going to come out naturally if it's not used to. Your ear can't expel kind of really, really thick, hard, compacted wax. There's no way on this earth it's going to be able to get that out. Look at that peeling away, nice. So basically you can't pull that out. So what's going to happen is it's just going to sit in place and carry on hardening up. So yeah, best not to put anything in your ears, guys. Your ears, the majority of the time, are self-cleaning. As we age, the wax, yes, it does dry. You're more likely to get wax problems as we get a little bit older. But if you put the olive oil in on a regular basis, that's going to supplement the oil you should be producing. And what will happen is the wax will stay softer. It's more likely to migrate out on its own. So yeah, you don't really need to be digging in there with cotton buds or Q-tips. It's kind of counterproductive for what we're trying to do. So I've got that, oh my goodness, I've got that left-hand side gone. But what we've got here now, what we're left with is the super dry, most impacted wax. Where is it? It's smack on top of the eardrum. I mean, on top of the drum. Now, what's happened is where the pressure, you can see where it's been sore on that left-hand side. The patient had been experiencing a bit of pain before they come in, and you can see why. It's all just been rubbing in that really sensitive part of the ear. But what's happened here is where you've compressed it, you've pushed it into all the nooks and crannies, and it's now dried in that spot. So as hard as I'm trying to pull it, those kind of edges that are arced into the recesses, they are holding on. So we've got this bottom section. There we go. Out that comes. I don't think it takes the whole thing, does it? Oh, I don't know. It's quite a bit. It might have taken the whole thing away. Look at that. Yeah, it did. How red and irritated that looks in there, guys. And this is the downside of using these things to try and clean your ears. Like I said, it's not a particularly effective way of doing it. And what you end up with is loads of this kind of really hard kind of wax. Now, it was only 2 patients. I apologize. And the last one was 3 patients. Now, this is a perforated eardrum, okay? Now, the patient knew they had a perforated eardrum a few years back. Perforation healed up. But what we can see is there's the perforation there, right? It gets more interesting, though, as we go along. Now, see how this skin here looks wet? You know, if you've been in water too long, your skin gets that kind of white color to it, you know, when you go all pruny. So this is what you end up with. This is, you can see the skin is exactly like this. It's basically been very, very wet in here. and we'll show you why in a second. So I'm getting rid of all this skin. Now the patient wasn't experiencing any hearing issues. What they were experiencing was getting like a little bit of discharge when they woke up in the morning, but also very itchy, and that's really common when you have a wet perforation as we've got here. Now this is obviously opened back up relatively recently because the patient has been experiencing, you know, these issues just for the last sort of probably about the last 8 weeks. And you know, they had been to ENT, they originally had a perforation healed, it's opened back up. Why would that happen? There can be lots of different reasons. Patient may have had a little bit of infection. You know, it's pressure changes because the skin is going to be very, very thin over that eardrum. The repair, sorry, with the, can't get my words out. With the eardrums repaired itself, that skin's going to be much, much thinner than the surrounding skin, just because you've got this, you're lacking these kind of fibres right in the middle of them, which give this the eardrum its structure. But we're really kind of getting rid of all this old dead skin. Patient will be experiencing a little bit of itching, you know, when we remove the skin, just because the air can now get to the fresher skin underneath, and it's going to dry it out, and that can give you quite an itchy sensation as well. Look how thick that layer is there, just from being constantly wet all the time. And you are far, far more susceptible to infection when you've got this type of perforation. So we're just gonna, well, any type of perforation is gonna make you more susceptible. But when your ear canal, if it's a dry perforation, the only issue you're gonna have is you ever get any water in there, that's gonna cause the problem. When you've got a wet perforation, you've got a lovely, you know, not quite body temperature, but almost there, environment, and you've got it wet, so it's a perfect breeding ground for infection. Now you can see I'm very, very cautious here because we've got a lot of skin, and it's just going all the way down the canal. I've got to be really careful of going across this eardrum though. We don't want to really cause an eardrum peel if we can help it. There we go. Right. I know it's difficult not to see what I'm doing on the right, but take a look at the perforation on the left. Look at that. See that? Look at that. See how we're pulsing here? Look at that. How interesting is that? Look at that bubble. Now, why is it doing that? So I tell you why it's doing that. We talk about the eustachian tube and equalizing pressure in the middle ear space. This is actually happening when the patient's breathing. That's actually the movement, and what you'll see there, and the pulse as well, is happening in here. So what we had there, where you could see that kind of almost look like a bubble was about to pop, it's the fluid discharging through that hole. Okay, so it's constantly discharging. Don't forget that middle ear space is lined with mucosal, mucus producing cells, or mucosal lining. And what's happening is where it's producing all that mucus, which is what we normally swallow away, travels down the eustachian tube, we swallow it out, but it's going to find the path of least resistance. So in that case, it's much easier to pop out of a hole than it is to try and travel down a tube. And that's what's happened with that particular patient. So all that wet skin was because that you had this constant leakage of all this fluid through that hole, and it was just constantly keeping that piece of skin wet. So yeah, really, really interesting one, that one. And what you could see, that kind of pulsing effect, was just where you were getting that kind of liquid discharging through that hole. So we're down to the last little bit on this one now. So this is we're down to the last minute. So basically this was just a very, very dry, now this was actually this patient's other ear canal, I think it was the other patient, I think it was that one. I've thrown myself now, I can't quite remember. But we've got this very kind of sticky, dry layer on the outside edge. So we're just lifting, you can see that thick skin as well. There we are, just peeling. And lifting, there we go. Similar kind of thing. Look at that peeling away, this long, long, thick peel there. There we go, just taking this last little bit off. You can see I'm waiting for it to try and detach on that bottom left-hand corner. There we go. And again. There we are, just trying to peel this away. There we go. Now we should get that lovely peel. And this detachment, you can see it's such a dry layer. I might be able to go in with a set of forceps. Oh, there we go. Just broken away with the suction. And out. that comes. And there we go, eardrum looking so much healthier on that side. Oh, hang on. I think I try and get this last little bit, but I don't think he detaches. Does he? I did try, but we end up with this very, very thin layer, and we start to get a little bit of clarinetting there. So I'm trying to bunch other stuff. Sometimes if you bunch a little bit more into the suction tube, you don't get quite so much of a problem with clarinetting, but there we go, we got it. But very, very dry canal, so patient definitely needs to use a little bit of olive oil. So just under 3 centimeters, 1 1/4 inches there. Well, guys, thank you very much for watching that video today. If you do enjoy the videos, don't forget you can always like, heart, share, follow, and subscribe for me. If you thoroughly enjoy the videos, you can also consider becoming members of the channel. That way then you get to see even more videos. But until next time, guys, take care of yourselves, take care of your ears, and take care of one another, and I'll see you again soon. Bye, everybody.